Thank you very much. Will I share my slides?
Yes?
Okay, they are there.
No, no.
I can share?
You
Okay.
can share yourself.
Okay, thank you. I believe you see them. Your
Yes.
Majesty, Queen Mathilde, Honorable Ambassador, I feel very privileged to be able to share with you a few reflections on mental health in the Africa region. I am the regional advisor for mental health and substance abuse here in the Africa region. My talk will look at the burden of mental, neurological, and substance use disorders. I will talk a little bit about COVID-19 in the Afro region, and then talk about the disorders that result from COVID-19. What evidence do we have? It's not very much, unfortunately. I will talk about the disruption of services and then some of the interventions that WHO has put in place in order to ensure that we strengthen mental health and psychosocial support. It's a very high overview. I'm not going to get into details in any of these areas because of time. But we know even before COVID that mental and neurological disorders were very high up in the burden of disease of sub-Saharan Africa. People tend to think that we have only HIV and AIDS, or maybe only TB, mainly communicable disorders, or reproductive health disorders. But as you can see, mental and neurological disorders are 6. And if we add in the neurological disorders, then we go up to 3rd. This is quite a huge burden. So Africa actually has to deal with a double burden of disease even before COVID. We also need to note that epilepsy, 85% of the epilepsy burden globally is found in sub-Saharan Africa or low-income countries. Another area I want to talk about, which we often do not talk about, maybe because of the stigma, I don't know, but it's that of suicide. Suicide, unfortunately, is from the latest data that we have from the Global Health Observatory, WHO's Global Health Observatory. You can see there that for males, the Africa region is highest globally. When it comes to females, the Africa region is 2nd. But when we look at individual countries for females, unfortunately, the Africa region is 1st. Lesotho is the highest for suicide globally. And then for both sexes, again, the Africa region is highest. And this is an area where we don't talk about and we haven't really been doing very much, even before COVID. This is the suicide rates, as I mentioned. I will not dwell on this one, but you can see the very, very high rates of suicide in Lesotho, 87.5 per 100,000 population. It's not a percentage, it's per 100,000 population. And the next country then is at 40. So it doubles the rate of the next country, which is really very high. If we look at alcohol consumption, which is another area of concern, and especially among young people, we find that young people, 13 to 15-year-olds, are consuming alcohol. And this one shows the number of young people consuming alcohol in the different countries. If you look at Zambia as an example, almost every other young person, 13 to 15-year-old, has consumed alcohol. That is a lot. That is a lot. And I will not go through the other numbers, but we can see that we do have a lot to worry about even before the COVID came into effect. The other issue, of course, is the funding that goes to mental health in our region. You can hardly see the bar because that estimates, this data is for 2017 Atlas. But we don't yet have the new data. I doubt it will have changed very much, but you can see 10 cents of government expenditure per capita is spent on mental health. Unfortunately, this 10 cents is going mainly to the psychiatric institutions. It goes to the big psychiatric institutions. It's not getting to the community. It's not getting to primary health care. And because the amount being put in is so little, you end up with institutions that look like that picture on the left. I took that picture in one of the countries, and that is a mental health institution. So while we believe that a lot is going into institutions, how much goes in is still not enough to maintain quality of care in those institutions. The other area, of course, is that of mental health workforce. We have a dire shortage. Africa, there you can see, has less than a whole person for 100,000 of the population, less than one whole person looking after mental health care. And the percentage, the number of people, the allocation of that less than one person actually goes, well, 1/3 goes to maybe specialists like psychiatrists. Another 1/3 goes maybe to psychiatric nurses, but we have this huge number, almost the same number as psychiatrists, who are other paid mental health workers, often not qualified. So these are the people we often call nursing aides, who are in the psychiatric hospitals. And that is another big problem we have to deal with. This one looks at the amount that I talked about earlier, how much goes to the psychiatric hospitals. So I will not dwell on that. But as you can see, in low-income countries in general, and we know Africa is like this, very little goes to the primary levels. As we deal with the weak mental health services, then we got the emergency, the COVID. And it's not just COVID. So this map shows the state of emergencies in the Africa region. So for many countries, COVID is the big emergency. But as you can see for the Afro, all 47 countries are affected by COVID, of course. But we also have Ebola. Guinea is about to come to the end of counting down, but they have been affected by Ebola. And Ebola has been in the DRC on and off over the past few years. Nigeria and Ethiopia have protracted grade 3 events. In the northeast Nigeria, we have the insurgency, but right now in Ethiopia, we also have the Tigray situation going on there. And then most recently, we had the volcanic eruption in Nyiragongo. So you have one thing on top of another. These are the number of COVID cases in the Africa region. And right now we are going through a third wave. So those are the two waves. In about July of last year, we got the first wave. We got the second wave in about January, February of 2021. But right now we're going through a third wave, and almost all countries right now are going through that. You can see active cases in South Africa. They have been the hardest hit. South Africa has been the hardest hit by the COVID, but we also see Kenya, Algeria, Ethiopia, and many other countries right now have very high numbers every day being reported, which is something we have to remain worried about. On top of that, vaccines have run out. Vaccines in many countries have run out. Many countries have not been able to vaccinate their populations as they would like. And of course, that is a big worry, especially for the healthcare workers who have to be at the front line. So when we look at mental, neurological, and substance use disorders, the commonest conditions reported are depression, anxiety, but we also see post-traumatic stress disorder being reported among the healthcare workers. But we also know that people who suffer from COVID and then recover themselves do get something like a post-traumatic stress disorder. They get anxiety and they get depression. The data that we have is from other countries other than Africa, other regions of the world, but we believe that it could be the same for Africa. There's some evidence to suggest that 45.6% of South African students reported anxiety symptoms, and 35 reported feelings of anxiety. The mental disorders that are reported increase as one gets closer to being a patient or to being a responder. So people in the general population will have the list, but of course, if they have lost a livelihood, it goes up. If they have lost their jobs, if they have lost a loved one. But if they are contacts of somebody with COVID, or maybe they have ever been quarantined, then the rates go up. If they have themselves suffered from COVID, the rates go up even higher. And then we have the healthcare workers. And looking at the numbers of people who have gone through COVID and the number of people who have died, we can extrapolate the big burden of mental health conditions that we actually have going on. And yet the amount being put into the response is not that high. We did a survey, WHO did a survey. It was a global survey carried out mid last year. And I only pulled out, I think, only 2 slides from the report. We did have disruptions in services. We had major disruptions in services. This is for mental, neurological, and service use disorders. And for the Africa region, the biggest disruptions were in school, mental health services. And I believe the other area was for alcohol use disorders. The causes of the service disruptions, as you can imagine, were due to patients not being able to attend due to the travel restrictions. We also had some of the mental health units being repurposed to COVID. Very many countries reported that the mental health units were the ones that were repurposed to COVID, and therefore our patients could not attend services. A lot of our healthcare workers also repurposed into the COVID work because they were looking for the allowances, looking for, a better pay than their regular pay. And so these are some of the challenges. But in providing PPE, personal protective equipment, very often the people in the mental health units were not provided PPE, or if it was provided, it was not adequate, and so putting the patients as well as the providers at risk. In responding, all countries in the region, almost all countries responded that they had multi-sectoral platforms like an MHPSS technical working group. So that was something good. Most of the countries responded. They do have it, and they have developed plans. Unfortunately, I forgot to include that slide. Only 27 of the plans that were developed were actually fully funded. So we have a gap in the funding. Only 27% were fully funded. So while people are developing the plans and integrating them into the humanitarian response plans, the mental health plans are unfortunately not being funded, and that is a big challenge. So as a response to this, for the first time, and I believe it is because of the recognition that COVID has had an impact on the mental well-being, not just of the responders, not just of the survivors, but the whole population. For the first time, the discussions on emergency preparedness and response included mental health. So in January, a decision was made to promote, to strengthen mental health health emergencies. This was made in the executive board. And then in just last month in May, this decision was endorsed by all countries. So mental health preparedness and response is to be integrated into emergency preparedness and response and strengthened. And WHO and partners are called on then to provide support for this at the country level. So that is a very good thing. We hope to be focusing on this in the days to come. We had a regional meeting as a result of this. We had a regional meeting for the French-speaking countries on the 2nd of June. The report will be coming out very soon, but we hope to be holding other meetings to strengthen the mental health preparedness and response in the African region. I believe that's where I stop. Thank you very much.